This is our workshop series chatting about pre and postnatal journey. Um, I'm really excited about this topic because being a mama myself, once upon a time a pregnant person, this is a huge passion of mine. And I'll just jump right in to this topic and introduce myself. So I'm Lynn. I am a Vancouver birth and postpartum doula, and I'm extremely passionate about birth and the transition and growing your family, and especially the postpartum recovery period. I am a mom of a very spunky, almost 3-year-old, and a wife to, I wrote in my little Facebook intro that I'm a wife to my college sweetheart, blah. He's He's a pretty great guy. I am fortunate enough to build my doula business with him, and he is my business partner. And I am a daughter of a very hardworking single mama, and um, I've been surrounded by incredible women in my life, and very fortunate to be surrounded by people that inspire me every day. My journey into the doula world or birth world was completely out of by chance. I was in a very different world. I was in the tech sector under HR, and everything changed when I had my little. I had no idea about what to expect in pregnancy, birth experience, and hearing about my mom's birth experience and my grandmother's birth experience. I was like, how complicated can it be? Don't you just roll on into the hospital and you roll on out with your baby? And I had a 180-degree experience with my birth, and I really wish someone gave me a heads up on what to expect. And I had a pretty crummy postpartum journey after that. And when I was in my really rabbit hole of what ifs and whatnot, I was curious about doulas, and I came across a intensive doula course online and met a wonderful doula trainer out in Seattle because it was still COVID-ish around that time, so nothing was really in person. And I just completely fell in love with everything about birth and seeing birth from the other side after having my daughter. So I'm really excited to share what I've learned as a doula, but also I wanted to validate all the experiences, especially for first-time parents going through birth. And I want this session to be also interactive. You're more than welcome to keep muted or just, give me emoji reactions or whatnot. But I would love to learn more about you and what you want to get out of this session. So if you would like to share, I would love to know whether, actually, I'll put a poll, that way it might be easier. So let's try to figure this out together if there is a poll option. Okay, here we go then. Okay. Anyway, if you wanted to jot in the chat of who you are in terms of whether you're a first-time mom and expecting, or a parent already and you're just wanting a refresher, or if you are a support person supporting an expectant parent, that would be wonderful. Congratulations, Olivia. The summer babes are coming in hot and strong, so you are in for a wonderful, wonderful ride. So congratulations. Thank you for sharing that. So in the next series, oh, and another Jolene, another expectant mama to you next. Oh my gosh, so fast. That's amazing. Thank you for both for sharing. Very, very excited for you and congratulations. I hope your pregnancy has been going well so far and you're super excited for your birth. So in the coming weeks, we will be going through a various number of topics, but I tried to condense it down and do a crash course. Some of these prenatal courses can be weeks on end, so I tried my best to really consolidate and get the meat and butter of birth. But if you have any questions at all, please don't hesitate to message me in the Facebook group or just reach out to me directly. I would love to craft and change the topic, even if there's something that's you really want to focus on, or you wanted to dive into a little bit more in the coming weeks. But for today, we'll start off with labor and birth preparation and what to expect for the big day. Next week, we'll talk about the importance of building your support team. So whether it's with a partner or a friend, a trusted friend or a family member that you want to have at your birth experience, and also your extended birth team as well, whether you are having a hospital birth or home birth or wherever you choose to have your baby. The next week after that, we'll chat about postpartum recovery and how to set up the home space for the optimal recovery for yourself and also for your baby, and just some tips and tricks that I've picked up as a doula myself. And lastly, we'll close off the series with car seat safety. I am a certified child passenger safety technician, otherwise known as a car seat tech, and I am certified under the Child Passenger Safety Association of Canada. So it is a nonprofit that educates and advocates for car seat safety or car safety for infants and littles. So this is a huge passion of mine, and I learned a lot before I became a car seat tech. So we'll dive into all the different types of car seats, not only the infant bucket seat, but how to transition to an eventual booster seat as your littles grow. House rules to start with, please take care of yourselves. If you want a snack, if you want to go to the washroom, if you need a stretch break, please take care of yourself. And if you have any questions, feel free to interrupt too. This is meant to be a collaborative conversation, and I'll probably get tired of hearing my voice the whole time anyway. So if you want to drop anything in the chat, please feel free to. But my one house rule, please take care of yourself, especially as a pregnant person. And if you need a snack and you need a stretch break, you don't have to ask for permission, just you do you. All right. So diving right in, labor and birth, the journey to finally getting to meet your baby. I wanted to start off this topic with my definitions of birth, because there's a lot of conversation when people see that you're pregnant, or you might have experienced already people just kind of making it about themselves of whether, what their birth experience is like, or you should do this and that. But this is your birth experience, and you get to tell the story of how you will give birth. But how I see birth is that there are four, I guess, experiences. It could be a combination of these experiences, because we are also working with a little who is part of this journey as well as we get to meet them. So the first one, a vaginal physiological birth, is where the baby is born vaginally. There is medicated birth, where there are tools, medication that can be involved or assisting with the birth experience. This includes anything from induction methods at the hospital and pain relief options as well. Unmedicated birth is where we see birth where medication was not involved or it wasn't requested by the birthing person. And oftentimes they are giving birth in what's called a water birth. So whether it's in a nice big tub or bathtub, people experience unmedicated birth in the tub or in water. Lastly, surgical or cesarean birth or C-section birth, where the baby is born via cesarean or C-section, and this is a hospital birth. I wanted to start off talking about physiological birth, vaginal birth. It's almost as if when we prepare for birth, immediately we think that vaginal physiological birth is the first route, but there are many options that are available for people, and to each their own on what's really empowering for the birthing person. So to start off with physiologic birth, it is a very long journey for your baby to go from womb to the outside world. So I get a little sciencey talking about the physiology of what's happening in your body when baby's ready to go. So this is the female pelvis, and the female pelvis is flexible and it's meant to move to help baby navigate through a very narrow space. And so this is a baby. This is around a 4 or 5 month ish baby, so this will not exit from you. I do a lot of lactation consulting. So when I received this, I was like, this is not a newborn, ma'am. So please don't fret that this giant child is going to exit out of you. But just for perspective, babies are born what we call in occiput anterior is OA is when baby is facing mom's tailbone essentially. So this is a female pelvis, this is the front of your tailbone, and we have the tailbone and the sacrum, which has a lot of nerve endings. The optimal position for baby to be, we're hoping around 32-ish weeks that baby is heads down. So they make their way heads down, going from here to heads down. And they also have the placenta and their cord, of course, but eventually if baby can make their way heads down, they may start in one direction, they may flip in a different direction, but optimal position is heads down. There are breech births or positioning where breech is when baby's feet is downwards. So there are limited number of care professionals who can support a breech vaginal delivery, but not to say that it's impossible, but oftentimes depending on the birthing person's medical history and various other medical reasons, they may be recommended a cesarean. But there are a bunch of techniques to help bring baby to heads down position, and it's often associated with making more space in the pelvis. So there's occiput anterior. We talked about how baby's face is facing towards mom's bum. Occiput posterior, OP, is when baby is what's called stargazing. And not to say that an OP baby can't be born vaginally, but it does take a little bit of time. Because if you imagine baby going through essentially a pipe towards the birth canal, they eventually have to find their way in a position where they are kind of curving upwards and you meet your baby like this, hello, versus that's occiput anterior. Occiput posterior, that when they're in this stargazing position, they kind of have their chins tucked down. And if you have ever seen the carnival game where there's a bowling ball and there's a little kind of loop, and you have to push the bowling ball just enough for it to go over the loop, and then it kind of rocks a little bit. So that's kind of what happens with an OP baby, where they're kind of doing their chin tuck and they're trying to exit the vaginal canal, but they're kind of taking a little bit of time. So when we're at the pushing stage and, say mom's been pushing for, over 2-3 hours, we start to kind of think about baby's positioning. And that's, of course, where the medical team can help assess where baby's position is at that time. A huge question I get from all of my families is, especially the first-time families, is when is it go time? So we're laboring at home. When do we go to the hospital if we're having a hospital birth? And early labor is the longest haul. For some people, it can take days, it can take weeks, honestly. And it depends on who you ask when you learn of people's birth stories. But early labor is when contractions, and actually I'll step back. Some people experience what's called Braxton Hicks, which are practice contractions. It's when the belly contracts, but it's just a tightening of the belly and not necessarily pain, but it's kind of like when you pull a muscle and you're like, oh, that's not very comfortable, and it kind of just dissipates. Whereas true labor contractions, imagine them coming in waves. And so with early labor, contractions may be coming in every 20 minutes here, an hour there, 5 minutes here, and they're kind of all over the place. And what we want to get to is what's called active labor, is when contractions are coming in stronger, longer, and more frequent over time, but typically around the every 3 to 4 minute mark, what's called the 311 or 411 of labor, when contractions are coming in every 3 to 4 minutes, lasting for at least 1 minute over the span of a full hour. And prior to this, a really great sign or true signs of labor happening is when the mucus plug releases. So the mucus plug is a snotty plop of discharge, different from, I know it's been a while since we've been menstruating, but if at the end of the period there's increased discharge, or some people experience more discharge before their period, the mucus plug is essentially a plop of snotty discharge that can show up in your panty liner or drop in your toilet. It could also be followed by something called bloody show. And it's alarming to see blood in your pregnancy, but bloody show is essentially very similar to a period where the cervix is ripening and it is the uterine wall is shedding to get baby ready. Fun fact is that for a anticipated vaginal birth where labor is, if you want to experience labor, baby actually changes the chemical balance of their amniotic fluid to tell your brain that they're matured and ready to essentially be born. So it's a fascinating way that the body works with baby's arrival. It's very fascinating. So there's a lot of different hormones at play in the pregnant body, but when baby reaches a certain level of maturity, they do tell your brain that, hey, I think I'm ready to be born. And then that's where the onset of hormones kickstarts. Oxytocin is known as the love hormone. It's a hormone that I often use Marie Kondo, if anyone knows the spark joy. It's this feeling of just immediate love, but also we see oxytocin when we are making love, when we are around people that we love, and also when we're looking at our baby. But it's the same hormone that actually starts contractions and what is necessary for the contractions to keep coming so baby can be born vaginally. Oxytocin also continues after birth as well. If you decide to breast chest feed, the contractions post-delivery is when the uterine walls or uterus is contracting, and it's part of the recovery process. People also feel, in some other signs of labor, is that they physically feel baby drop. So we're going from, the pelvis, which again, it's quite high up, but the pelvic inlet is the widest point of the pelvis. So you may instinctively want to sway side to side, and having your feet outwards. And some people, it feels really good to do kind of deep kind of sumo squats. If you have a exercise ball and you kind of want to do hip rotations, that might feel really good, or be on the floor with a yoga mat or something comfortable and be on all fours and having kind of a nice child's pose stretch. This isn't necessarily something that you have to do. I don't want you to see this as step one, this is what you need to do to progress labor. It's more of just being intuitive with your body and going with what feels good to you. But for some people, they can physically feel baby in a certain position, and the drop is when baby is at a lower point in their pelvic bone. Cervical dilation is, for hospital birth, is what indicates baby's progress and how further down they are from in the pelvis. We talk about positioning. So in order to know how far you're dilated, you have to go through a cervical check. Not fun. It's kind of like going through a pap smear. You also don't have to have a cervical check, but for some people, it can help determine how much they've progressed. For a hospital birth, you have to be at least 4 centimeters dilated in order to be admitted to the hospital. Now, with the onset of contractions in combination with the intensity of the contractions, I guess the best way to say when it's truly go time is when you need assistance. So we want you to stay at home as long as possible, because your home is your most comfortable environment. You can eat whatever you want, you can move around, you can take a bath, you can shower. If you have pets, have those pet kitten dog cuddles, just be in your space. And we're such mammals that take a mama deer out in the woods, and if she's in labor and there is a predator nearby, she will stop or slow down labor and go somewhere safe and have her baby elsewhere. And very similar to us, for most people, the hospital isn't the most comfortable place to be at. And if you haven't stayed at a hospital ever, the sounds of the hospital could be very, anxiety inducing for some people. People are asking you a million questions, which is very uncomfortable when you are in labor. People poking at you with, say IV fluids, or just the environment in general could be raising some cortisol levels, which is the stress hormone. And that's why we want you to stay at home as long as possible until you need extra support. Lastly, people feel the sensation of wanting to go poop. And that's a pretty good sign that your baby is in position low enough that things are happening. Things are happening. And so what we want to avoid is, if you are having a hospital birth, that you're going in and out of the hospital a million times. Not to say that, if you need help, whether with pain medication, that's okay. But going in and out of from your home to the hospital to back, it interrupts the labor process. And I also say to people, going back to contractions, don't time every single contraction. If you're noticing that they're coming in much closer, then maybe you can time them, but I wouldn't get too linear in just seeing just the number of contractions means it's go time. Really be in tune with your body and know when you need to ask for help. I do also want to talk about the importance of knowing what is involved in a cesarean birth. While it's not most people's first birth preference route, statistically, in BC specifically, almost 37% of babies are born via C-section, and nationally across Canada, it's about 28%. And by medical definition, an emergency C-section is when labor is present. And there are, of course, situations where baby needs to be born quickly because of a health risk of mom or baby. But there are also, I've supported C-sections where the family had a full 12 hours to think about a C-section, and that was the best decision for them. So I want to take the fear away from the process. It is major abdominal surgery, but the more information you can get from what is involved in a C-section will I'm one that with the more knowledge, it'll lessen the stress levels from going up and your hackles going up if this is a situation that happens to you or anyone that you know. And yeah, it helps to visualize what to expect if this situation happens. So I have a little felt board that I like to show my families because it is major abdominal surgery, and 7 layers of tissue is being performed on. But there is an opportunity for you to go into, whether it's your vaginal birth or C-section birth, with the mindset that you have the opportunity to choose what that experience could look like. And we'll talk a little bit about crafting your birth preferences, but some of the most beautiful births I had witnessed as a doula have been C-sections because we were able to play the family's favorite music. We had an incredible team that was supporting the parents, and also we got to take photos. So there are a lot of opportunities that you can make the birth experience your own, and it doesn't have to be a procedure that happens to you. So with C-sections, we have the first layer, and it is a incision about the size, about maybe 3 inches, and it is right on the bikini line. So this is the epidermis space. And then the first layer that gets performed on is the fat tissue. From there, we have the fascia, which is a thin layer of tissue. The abdominal muscles are pushed to the side, We have the peritoneum, which is another thin film tissue. Then we have the uterus, and of course we have the bladder was there, but we had to actually move the bladder out of the way. Have the incision of the uterus. If your waters haven't already broken, the amniotic sac is broken, and then you meet your baby. And a midwife taught me this once, but when labor is present, even in a cesarean birth, the baby actually gets rotated so the baby can also experience birth as well. And I thought that was a beautiful way to honor the experience. And something that I'm very passionate about saying is, and why it's all important, is that birth is birth, regardless of whether someone goes through a physiological vaginal birth experience or a C-section birth. Birth is birth. And the reason why I want to talk about that is because I had met a wonderful mom who was in her 60s, and I do postpartum belly binding, and I buy my fabric from her. And this woman I was telling her, she was curious about my work as a doula, and she had 3 babies, of course, adult children now, but all via C-section. And she said, but I didn't experience birth. And that blew my mind, thinking that here we have a beautiful woman who is in her late 60s, thinking that she never birthed her children, when I had to stop her. And I said, yes, you did. You absolutely birthed those babies. And this is why I'm such a strong advocate to say birth is birth, and that whatever decision that you make in your family's decision of what is important to your birth experience, you birthed that baby, you nurtured, you grew a human, and that's an incredible thing to me. So that's my little spiel. I'll pause here in case you have any questions about the 2 birth experience, but I also forgot to mention that I get a lot of questions on, I guess, debunking waters breaking. Oftentimes we see the cinematic water breaking and people think it's go time, but not everyone's water actually breaks. It actually depends on where baby's position is, but oftentimes if the rupture of the amniotic sac is higher up on the belly or behind baby, it could be a trickle of fluid, and that's why oftentimes people think they peed themselves. And for ruptures that are close to the front of the pelvis, it is a gush of fluid. Some people feel kind of like an elastic band popping or a water balloon pop. And from there may be the onset of contractions happening, or the mucus plug or bloody show shortly after as well. But for some people, their water doesn't break and their mucus plug passes, their bloody show passes. And we have some babies born what's called on call, where they are born still in their amniotic sac. So I've yet to see that. I would be mind blown and super excited if I were to be able to witness and support a baby on call, but it does happen. So I wanted to mention that. The next thing I wanted to talk about is talking about your birth preferences. How do you want to experience birth? And we'll talk a little bit about your infant feeding options as well. How do you want to feed your baby? We'll then dive into pain management and what the various ways and tools that you can use to cope through labor if you would like to experience labor. Lastly, we'll close off a little bit, and we have a whole topic about building your support team, but think about who you want in your birth room. I also forgot to mention the choice of whether you want to experience labor. People don't talk about that because there is the option, and there are valid fears of labor. And so there are situations where people decide to either induce their pregnancy, or they wanted to go through an elected C-section. And for some people, that sense of control in choosing when and how you want to experience your birth is the most empowering experience. And birth isn't this linear experience where you have to go through these number of steps. So just thought I'd clarify that. So with your birth preferences, unless there is a medical necessity for intervention or that mom just wants to choose how they want to experience birth, there are various options. And afterwards in the Facebook group, I'll share a birth preferences sheet that I like to share with my families. And it's a PDF, so you can print it, or if you don't have access to a printer, you can reach out to the Mamas for Mamas team or print it out of the library. But it's a great tool to have with you in your hospital bag. And you can discuss all the things with your family and you're, looking at all the options that are available for you and communicating that to your birth team. An acronym that I really like to encourage my families to ask about is that in any situation where you are unsure of which route to go, it sounds offensive, but to use your brain. And this stands for asking about the benefits, the risks, the alternatives, whether you need more information, or what's your intuition, your gut feeling saying, and what happens if we do nothing. So when we look at your due date, I don't love saying due date because it seems like by this date, I must have my baby. And if people are late, they get really frustrated. And last summer I had 2 42-weekers, and that's how some babies, they want to take their time. Of course, there are, your primary care team, whether it be your midwife or OB or family doctor, they will provide the information of, any risks or whatnot pertaining to your medical history. But again, if you want to experience labor, babies also decide on when they kind of want to come into the world. There are situations as well where premature babies also come as well. But the BRAIN acronym is a really good way just to ask your primary care provider on all the various things that could come up in discussion, whether you need to be induced or whether there are certain interventions during the birth delivery experience that you'd like to ask more about. Infant feeding. So we have options with that as well. There are parents who decide that they would like to exclusively breast or chest feed from their breast. There are exclusive pumpers or what's called exclusive bottle feeding. And there's also combination feeding. Maybe parents want to experience breastfeeding and also have the bottles so another support person or extended family can support. They can also get donor milk. Donor milk can be through requisition from the hospital if your baby needs donor milk. Or there's a wonderful resource on Facebook called Human Milk for Human Babies. And there are people willing to donate their milk, and they're transparent about their, milk preparation or their storage. Or they may be over producers that they're willing to share. The only difference is that with donor milk, they are donated and pasteurized, and they have a very rigorous process, particularly through the hospital setting, where they have criteria on who can donate, and the process is to make sure the milk is prepared. And typically they are prepared for babies that are sick or they are under the guidelines of NICU standards. Whereas for otherwise healthy full-term babes, a family may choose that if human milk is important to them, Human Milk for Human Babies is a wonderful online community that you can reach out to. And formula. I have nothing against formula, because formula for the babies that need it, it could be medicine and life-saving. Or some families, they do not want to experience breast chest feeding, and that's absolutely okay. You choose how you want to feed your baby, and my go-to is a healthy, happy mama means happy, healthy baby, and fed is best. So know that there are options, and there are various resources and support groups to help you through whatever method you choose to feed your baby. And it doesn't have to be set in stone either. If you change your mind, that's also an option, and you can try different things. If it's not working, then you pause, or you choose a different route. Very similar to birth, where it's not linear. you have options and you can ask for help. Pain management is a big topic for those that are wanting to experience labor, but while pain is expected in labor, we do not need to go through the suffering zone. There is a difference between pain and suffering, because when it's kind of like running a marathon. I'm not a runner, but my husband is. But when you are training, there is, certain joints and muscles get, tired, and we are essentially running a marathon while we're going through labor and birth. But you know your body best. And if you are not, it's funny to say you're not enjoying the ride, but I've heard from some laboring, birthing moms where they hit a point in labor where they got a routine and they got a rhythm going through their labor, that it was enjoyable at one point because they felt that power. But you know your body best, in that if you are suffering, there are tools that you can use to cope through labor. So I often get asked, what are the various tools for non-medicinal tools or medicinal options if I'm having a hospital birth? So the first set of tools that are often readily available for non-medicinal options: hydrotherapy. So taking a nice warm bath, or sometimes even the contrast of the shower head kind of hitting the back of your head while you're in a bath. Hospitals also have, depending on the hospital you choose to birth at, they will have a nice big bath or a tub where you can have both a shower and you can kind of move positions that way. Heat is great too, so a nice heat pad. I have a nice heat pad with me at all times because I'm always cold, but also it really helps to relax the muscles. Counter pressure we'll talk about in the support partners or support persons workshop, but counter pressure is helping to alleviate the tension that's building in the pelvic bone. So we'll talk a little bit about that at a later time. Massage, I always have massage oil with me, and just finding points of tension. Acupressure is finding those sections of space where you feel a lot of pressure, and working with a acupuncturist or a traditional Chinese medicine practitioner, if you're into that, can help educate you on various pain coping positions as well. TENS machine is a wonderful non-medicinal tool that pretty much all my mamas love. It's very similar to the Dr. Ho's abductors, if you've ever seen that, but it's a little machine. You can also see if your local pharmacy or some doulas in the community will also rent out a TENS machine, but it sounds scarier than it is, but it stands for transcutaneous electric nerve stimulator. So it sends little electric shocks through the back of the body, and it helps to divert the mind from focusing on the intensity of contractions. Diaphragmatic breathing, we're such shallow breathers when at times of stress, so we'll do a little exercise since we're running a little short on time. But it's to help really control the breath, and the bigger the breath that we can take, we can work through pain. Medicinal options that are available at the hospital: there's nitrous oxide, laughing gas. It doesn't remove pain, but it takes the edge off for some people. So breathing in and out of the mouthpiece or a mask is available. Morphine gravel is a shot to the bum, and for people that are in early labor and not coping through early labor very well, they may choose to go to the hospital and get a morphine gravel shot. Morphine is paired with gravel because of the side effect of getting really drowsy, and you can get sick, nauseous, I mean. So that's why it's paired with gravel. And then you get to go home and try to sleep or rest, and it gives a little break from the contractions. Fentanyl is a option to be given through an IV, and it's more fast acting, around under 30 to 45 minutes. And lastly, the epidural is a procedure where essentially the whole the area of the spine, oftentimes people think of this big needle, but it's actually the numbing needle that numbs out the spinal area, and the epidural itself is a thin plastic catheter that gets inserted in between the spinal cord. And from there, the epidural is a mixture of pain medication that can help take away the pain of contractions, but it doesn't take away the pressure because of baby's positioning with a vaginal birth. So these are just some of the options that are available. Very quickly, your support team. Again, we'll go through a whole topic on this, but consider building your support team, whether it is your primary support team, support person joining you for your birth, whether it's a partner, sister, parent, or a friend, anyone that you feel safe with and who will have your back. Your primary care provider is your midwife, your OB, your family doctor, the one that is catching or delivering your baby. We tend to not say deliver anymore because babies aren't pizzas, but they are your go-to primary care provider for delivering your baby. We have your labor and delivery nurse at the hospital. You have a nurse with you the whole time charting. If they're not with you, they are monitoring from the outside if you have a continuous fetal monitoring, but they are the people that are assisting in the labor process, potentially not able to physically support like a primary support person, but they are checking for vitals and making sure you and baby are doing okay. If you choose pain medication options, the anesthetist is available. And with the timing of the epidural, that really depends on how many people they are seeing, the anesthetist is seeing during that time. So if you want an epidural, I have some tips on that. Just get your blood work done prior to going into labor and delivery, just so they can check your platelets and make sure that you are a candidate for the epidural. And the OR team, if it is a C-section, it feels like a whole football team, but everyone has a role. There is your main obstetrician doing the surgery, at least 2 standby nurses or surgical nurses, an anesthetist, a pediatrician who will check on baby afterwards, 2 or 3 other standby nurses or residents, a resident OB, and your support person or a doula. So it's around 10, potentially 12 people in the room. So I always just preface, if in a C-section situation, people get alarmed, not necessarily about the procedure, but just how many people are in the room. Lastly, there are lactation consultants in many hospitals doing rounds. If breast chest feeding is something that you would like support in, there is, or through your midwifery clinic, there may be a lactation consultant or an IBCLC, which is an international board certified lactation consultant. Lastly, why would someone work with a doula? A doula is someone who can help with informational support for prenatal courses or prenatal support, being at home to support you through labor, of course, emotional and physical support, and of course, the attending of the birth of your baby and supporting in any way that you need. I'm kind of flying, and we are kind of out of time. So if you are needing to hop out, totally okay. But very quickly, I wanted to do a super fast activity. If you have a comb or just something to grip, I wanted to, maybe we won't do the activity just because we are running out of time, but if you have an ice cube accessible, that'd be wonderful. If you do, give me a thumbs up if you are able to quickly get an ice cube. I'm sorry I'm rushing you on this, but I'll give you maybe a minute to get an ice cube. And I wanted to show a quick activity on how to cope with contractions. So amazing. Thank you for the thumbs up. So give me another thumbs up if you have your ice cube ready. Amazing. Perfect. All right. So we got your ice cube and maybe a quick towel afterwards if you're kind of dripping. But first exercise, I want you to squeeze that ice cube, and I'll tell you when to start. When you squeeze that ice cube just on its own, as long as until I say stop. All right. So ready? Take the ice cube and squeeze. Go. All right, let that go. Collect yourself. Now, if you have a comb with you, and if you can also set up your favorite song on your phone or laptop, wherever you have accessible, and just start the music right away, and I'll tell you when to start with that ice cube squeeze, but on the other hand. So give me a second. You got your music, you got your comb, we're ready to go. Okay, I'm gonna assume we're ready to go. So in one hand, we're gonna have the ice cube, the other hand have a comb, and then start play on your favorite song. Ready, set, go. What I want you to do now, while your music is playing and you have that comb, squeeze that comb, because we have nice pain receptors that if we squeeze something like a comb, or if you have a squishy ball, just get that squeeze going. At the same time, I want you to groove. So whether you want to groove in a spot or do some nice little hip wiggles, just get your body moving. If you want some nice lunges, hum to the music. If you have a dog or a cat, look at your dog and they're probably like, what are you doing? You see your neighbor outside, hey, how's it going? And just keep on grooving. Almost there. Think about what you eat. What did you eat for breakfast this morning, actually? What are we gonna eat for lunch? I know we're going over, but think about what we want to eat for lunch. What's your favorite dish? I'm very curious. I would love some recipes that you've been craving during your pregnancies. I would also love some help crafting my music playlist afterwards. So please share your favorite songs afterwards. So, all right. So let that ice go. Let me know in the comments what you thought about the activity. But I also want you to take a wild guess on how long do you think our first exercise was when it was just the ice cube. Take a wild guess on how long you held that ice cube for. Did it feel like a lifetime? Okay. And how long do we think that second activity was for? With the music and the grooving and the comb. Wild guess. Do you think it was the same time, longer, shorter? Okay, very interesting. Felt shorter, however, probably the same. So the first activity with just the ice cube, no tools, was 1 minute long. That's around a contraction. The second, with the music and the grooving, was 1.5 minutes. So this is just a fun activity. Fun, I know it wasn't fun because I made you squeeze an ice cube, but this is a really great activity I like to do to just give perspective on how using tools to help divert the mind of not focusing on the pain of something can be really powerful. So whether it's a comb, you'll never look at a comb the same way until you have a baby or you go through labor, but someone talking to you, talking you through things, or maybe moving your body are all great tools to help cope through labor. So I know we're over time here, but I hope that was really helpful. I apologize for the technical difficulties in the beginning, but let me know if you felt that was helpful at all. And if you have any feedback on what you'd like to learn more about for next week's session. I know I zoomed past a bunch of information, but I'd love to get your feedback and help on making this workshop series on whatever you want to learn. So I'll leave it at that. We'll have lots of activities in the coming weeks, but if you have any feedback, please don't hesitate to reach out on the Facebook group. I also have my website with a bunch of free resources. I'll also send a birth preferences sheet and a labor coping worksheet as well. And if you can join me next week, I'd love for you to join me. And thank you so much for showing up and taking the time to learn with me. So hope you have the rest of your day and a great lunch ahead. Thanks all.